Welcome to the Medical Excellence Center. Today's class is about substances that cause hyperventilation, and we will use the mnemonic PANT to help you remember all those substances. Hyperventilation, characterized by rapid breathing, can be induced by various substances, leading to a range of clinical manifestations and complications. Recognizing these substances and understanding their mechanisms of action is crucial for appropriate management and treatment. The PANT mnemonic serves as a helpful tool to remember some of the common substances associated with hyperventilation. In this lesson, we will discuss each component of the mnemonic, including their descriptions, mechanisms, clinical manifestations, clinical considerations, and possible management strategies. P stands for PCP, phencyclidine, paraquat pneumonitis, and phosgene. A. PCP, phencyclidine. PCP is a dissociative anesthetic drug that can induce hyperventilation as one of its effects. Mechanism. PCP acts primarily as an NMDA receptor antagonist, leading to altered neurotransmission and inhibition of inhibitory pathways in the brain, resulting in disinhibition and increased respiratory rate. Clinical manifestations. Hyperventilation induced by PCP can be accompanied by other symptoms such as hallucinations, agitation, paranoia, and altered sensorium. Clinical considerations. Patients under the influence of PCP may present with unpredictable behavior and agitation, posing a risk to themselves and others. Management. Management involves supportive care, including ensuring a safe environment, addressing agitation with sedatives if necessary, and monitoring for any complications such as hyperthermia or rhabdomyolysis. Paraquat pneumonitis. Paraquat is a highly toxic herbicide that can cause severe lung injury leading to hyperventilation and respiratory distress. Mechanism. Paraquat exerts its toxic effects primarily through the generation of reactive oxygen species, ROS, leading to oxidative damage and inflammation in the lungs. Clinical manifestations. Paraquat poisoning initially presents with gastrointestinal symptoms followed by progressive respiratory distress, hypoxemia, and hyperventilation. Clinical considerations. Paraquat poisoning has a poor prognosis, and patients may develop severe respiratory failure requiring mechanical ventilation. Management. Treatment involves aggressive decontamination, supportive care, and administration of antioxidant therapy such as N-acetylcysteine. However, prognosis remains guarded despite treatment. Phosgene. Phosgene is a highly toxic gas used in chemical warfare and industrial settings, capable of causing severe respiratory injury. Mechanism. Phosgene induces damage to the respiratory epithelium, leading to pulmonary edema and hypoxemia, which can result in hyperventilation. Clinical manifestations. Phosgene exposure initially presents with respiratory symptoms such as cough, dyspnea, and chest tightness, progressing to severe respiratory distress and hyperventilation. Clinical considerations. Phosgene exposure requires immediate removal from the contaminated environment and prompt medical evaluation due to the potential for rapidly progressive respiratory failure. Management. Management involves supportive care with oxygen supplementation, bronchodilators, and in severe cases, mechanical ventilation and administration of corticosteroids to mitigate inflammation. ACE stands for acetylsalicylic acid, ASA, and other salicylates. Salicylate overdose, commonly from medications such as aspirin, can lead to hyperventilation as a manifestation of toxicity. Mechanism. Salicylates uncouple oxidative phosphorylation, leading to increased metabolic rate and respiratory alkalosis due to stimulation of the respiratory center in the brain. Clinical manifestations. Salicylate toxicity presents with a spectrum of symptoms, including hyperventilation, tinnitus, nausea, vomiting, and metabolic acidosis in severe cases. Clinical considerations. Salicylate toxicity can be life-threatening, necessitating prompt recognition and intervention to prevent complications such as cerebral edema and multi-organ failure. Management. Management involves decontamination, supportive care with IV fluids and electrolyte replacement, alkalinization of urine to enhance excretion, and administration of activated charcoal if ingestion is recent. In severe cases, hemodialysis may be necessary to enhance salicylate elimination. N stands for nerve agents. Examples: sarin, Gb, tabun, Ga, soman, Gd, and Bx. Nerve agents are highly toxic chemical substances that disrupt the function of the nervous system, including the respiratory centers in the brain, leading to hyperventilation and respiratory distress. Mechanism: nerve agents inhibit acetylcholinesterase, leading to accumulation of acetylcholine at nerve synapses and overstimulation of cholinergic receptors. This results in excessive stimulation of the respiratory centers, leading to hyperventilation. Clinical manifestations: nerve agent exposure presents with a rapid onset of symptoms, including meiosis, salivation, lacrimation, bronchoconstriction, muscle fasciculations, seizures, and hyperventilation. Clinical considerations: nerve agent exposure is a medical emergency requiring immediate decontamination and administration of antidotes to counteract cholinergic toxicity and prevent respiratory failure. Management: treatment involves rapid decontamination with soap and water, administration of antidotes such as atropine to block muscarinic receptors and pralidoxime to reactivate acetylcholinesterase, and supportive care with airway management and mechanical ventilation if necessary. T stands for toxin, toxin-induced metabolic acidosis. Certain toxins can induce metabolic acidosis, which may lead to compensatory hyperventilation as the body attempts to restore acid-base balance through respiratory alkalosis. Mechanism: toxins such as methanol, ethylene glycol, or salicylates can produce metabolic acidosis through various mechanisms, including the generation of toxic metabolites or interference with cellular metabolism. Clinical manifestations: patients with toxin-induced metabolic acidosis may present with symptoms related to the underlying toxicity as well as respiratory distress and hyperventilation secondary to compensatory respiratory alkalosis. Clinical considerations: prompt recognition and treatment of toxin-induced metabolic acidosis are essential to prevent complications such as multi-organ failure and respiratory arrest. Management: treatment involves addressing the underlying cause of metabolic acidosis, which may include administration of antidotes, e.g., fomepizole or ethanol for methanol or ethylene glycol toxicity, supportive care with IV fluids and electrolyte replacement, and in severe cases, renal replacement therapy to enhance toxin elimination. Conclusion: understanding the substances associated with hyperventilation and their mechanisms of action is crucial for healthcare providers in managing patients presenting with respiratory distress. The PANT mnemonic serves as a helpful tool in remembering these substances and guiding appropriate evaluation and treatment strategies. Rapid recognition and intervention are essential in optimizing outcomes and preventing complications associated with hyperventilation induced by various substances. Thank you for learning. Don't forget to subscribe to this channel.